Hey everyone, thanks for tuning in to our ongoing series, Question and Answer with Dr. Shaw and Whitney. Today we're going to be talking about units and units of Botox. So I think one of the things that a lot of patients wonder about, and they may have heard this from friends, is how many units am I going to need for the treatment that I want? Because maybe they've talked and their friend said, well, I had 30 units that I needed, or I saw someone else who needed 20 units. And so units can be kind of a confusing term, I think, for patients. So when you are discussing that with a patient, how do you kind of undergo, here's how much Botox I think you might need?
Yes, we often have people who compare stories about Botox and how many units they need or how much it might cost, but a lot of that's dependent on the individual.
Right.
It's dependent on their muscle movement, their genetics, their lifestyle, their skincare routine, but it's also depending on their concerns. How many areas are we treating? If their friend just gets 10 units in their forehead, great, but maybe their concern is their forehead, their frown lines, and their crow's feet, and when we're doing additional areas, we're looking at additional units. Allergan does have a standard recommendation of units that they would recommend, but I kind of use those as an average. It's definitely possible that we could need more. It's definitely possible that we could need less. I take a general approach of starting a little bit more conservatively with the knowledge that we can always come back and add a little bit more if we need to.
Yeah, I totally agree with that, and I like to do the same thing that you do, which is we'll have sort of a starting point where we think would be efficacious or give you the most bang for your buck where we start, but then we see patients back usually at 2 weeks when we've reached our maximum effect of Botox itself, and we'll reassess, and we may need to make minor adjustments at that time, but that sort of lets us know then going forward, here is the proper dose for you.
We hope you found this information helpful. If you have any more questions, just give us a call. We can always set up a consultation.